a lot of cancer patients are going to jump into the chemotherapy, radiation treatment right away. For those patients, what can a proper diet do along with those treatments?
Well, first of all, nobody with cancer is suffering from a deficiency of chemotherapy. Nobody with a headache has a deficiency of aspirin. So applying those therapies might kill some cancer cells, but it does nothing to change the underlying cause of the disease. So in many cancer patients, they're burdened with toxins which are interfering with their body's normal biochemistry. They have an abundance of nutrient deficiencies, fish oil, zinc, magnesium, vitamin E, etc. So you have to correct those. So when a cancer patient jumps into the chemotherapy without looking at what's the underlying cause, how can I nourish my body so it can better regulate and repair itself? Because the essence is a healthy human body is self-regulating and self-repairing.
You talk about underlying causes. What are some of those?
Well, let's start with the mind.
Okay.
Recently we had a great football coach, Joe Paterno, who was forced to resign in distress, and within 3 months this 80-something vibrant man died of non-smoking lung cancer. Depression causes a collapse of the immune system, which can cause the whole body just to allow the overgrowth of cancer or infections. Many other examples in the media. Dana Reeves was the wife of Christopher Reeves. After taking care of her quadriplegic husband for 9 years, a year after he died, she died of non-smoking lung cancer again. Depression and